Hello, everyone, and again, welcome. Just a few housekeeping items. The first one is the raise hand button is at the bottom of your screen. It says react. There's a heart. If you click on it, you'll see at the very bottom there's a little raise hand. So you can raise your hand when you have a question. We are going to have questions at the end of each speaker, and you can do that by raising the hand, or you can put it in the chat, and we will definitely have time after each speaker to answer questions. And then please remember, this is being recorded, so questions are kept to general. If there's any kind of personal questions, all our speakers' contact information will be there for you to contact them later. This is more of a, we don't want any confidential information put out there when it's being recorded. And then I think that is everything. Remember to keep your mics muted. And I think that is everything. If I forgot anything, Sharon?
Nope.
Give me a holler, and I'm going to pass it over to my colleague, Olga.
Buenas tardes, mi nombre es Olga y soy la persona bilingüe del departamento del programa de RIPIN. Si alguien necesita traducción de inglés en español, en la parte de abajo de la computadora, ahí está el CC, que allí usted puede entender todo lo que se está diciendo. Usted pide el idioma de español a inglés y puede participar en el webinar hoy. Y voy a pasar de nuevo para Sharon.
Okay, thank you, Olga. And Jane, this is
Okay.
for you.
Thanks, Sharon. So about RIPIN. RIPIN is an independent 501c3 nonprofit organization. We are peer professionals, so that means most of us have navigated the systems that we advocate folks for. And sorry, something keeps clicking up on my on my screen. Sorry about that. We help Rhode Islanders of all ages, abilities, and backgrounds access and navigate healthcare, education, healthy aging, and other service supports and complex systems. What is self-direction? Self-direction is a service model for folks who have been found eligible for BHDDH funding, behavioral healthcare, developmental disabilities in hospitals, and will, from now moving forward, say BHDDH. It allows the person and the family to manage their own budgets, hire their own staff, and pretty much set their own programs according to their own priorities. It's based on individuals' unique supports and needs and interests and their goals.
Okay, so tonight's self-directed support program, we are here to help support families navigate the systems of self-direction, as well as support you through training and education, resources, bringing transparency to the process, and referrals. And we also collaborate with other agencies to provide peer support and self-direction. So we're going to acronym bust right off the bat by referring to behavioral health care, developmental disabilities, and hospitals. This will be referred to as BHDDH, and you can access their website by using the QR code or bhddh.ri.gov. And BHDDH is a state agency that helps with lifelong support. So we're here tonight because mental health matters, and we're going to start our presentation off with the Associate Director of Clinical and Residential Services at the Division of Developmental Disabilities, Ms. Tracy Levesque. Tracy?
Good evening. Thank you very much. As indicated, I work for BHDDH, and I am the clinical and I oversee clinical and residential services for the Division of Developmental Disabilities. Within my role at BHDDH, I work with the internal social caseworkers, agencies, staff from developmental disability organizations, other case managers, individuals or families to help identify resources to provide mental health services that provide that service from a community standpoint. So whether you're working with a developmental disability agency and there's a clinician there, or you're looking to find services out in the community, we can help identify those resources. We also work collaboratively with our behavioral health team here at BHDDH, and we have some partners here tonight that will be able to share some more about what mental health services look like. And so without further ado, I'd like to introduce the Director of Behavioral Health, Tom Martin, and the Associate Director for Special Projects, Beth Matthews.
Thanks, Tracy.
You're welcome.
Thank you all. It's nice to be here today with you all. You can go to the next slide.
Okay. So Tom and Beth, these are the two questions. I know you have some slides that you're going to show, but just for our audience, these are the two questions we would like you to answer for us this evening. The
Okay.
first one is, what supports are available for individuals with intellectual and/or developmental disabilities looking for behavioral health and mental health supports?
Okay.
And the other question is, how can consumers access these supports?
Okay. Thank you. We'll give that a shot. And let's start with certified community behavioral health clinics, because that is where most of the services for individuals with IDD would get services. So certified community behavioral health clinics provide behavioral health services, which includes mental health and substance use services for individuals of all ages and individuals who may have any problems with ability to pay. So you're able to get access regardless of your age and your payment status. One of the things that you're probably familiar with in the past is what we had community mental health centers in our system. Certified community behavioral health clinics is a certification that you get from the state, and also it represents 116 standards from the feds that you had to have in order to become a certified community behavioral health clinic. So in our state, we have providers who actually have to be certified to do that. And one of the things that's important is we have populations of focus. In populations of focus, one of our populations is the individuals with intellectual developmental disabilities. The services that are required for certified community behavioral health clinics are the 9 or 10 that you see on the screen there. And let me just take a minute to talk about the 24/7 emergency services and mobile crisis. That means doing emergency assessments for individuals who have behavioral health crises in the community. That includes the IDD population. So if you have a behavioral health crisis, you can contact a certified community health clinic, and they can dispatch a team, a 2-person team, to go out and provide an assessment and initiate actually services for individuals who need psychiatric services and mental health services. Other services that we provide is general
I'm just going to
outpatient.
stop you there 1 second, just so that the interpreter can catch up. Hold
Sorry
on 1
about that.
second. That's
Sorry
okay.
about that.
No, that's okay. Okay, you can proceed. Thank you.
The other services are general outpatient services, which includes counseling and medication. So again, access those services are available. We have substance use services, primary care screening, person-centered and family-centered treatment planning, assessment and diagnoses, targeted case management. That is one that we probably have to review more closely, because sometimes that has an overlap with what's being provided in the care package for individuals with developmental disabilities. We have psych rehab services, and a very important feature of
Este es el programa que les puede ayudar a Tico.
You want me to continue? Sorry. Okay.
Yes.
One of the new featured services of certified community behavioral health clinics is having community-based mental health care for veterans, which was not something that was always in the old system, if you will. And also then we have peer supports, peer counseling, and family support and caregiver support services within CCBHCs.
Okay,
The second
That's a-
slide.
there you
The
go.
The second slide talks about implementation. So in October 1st, 2024, 8 sites for CCBHCs started in the state of Rhode Island. It is done by 6 providers. They are listed there. There are 2 in the Providence area. There is only 1 area of the state that is not covered. 91% of the state is covered. It's only the East Bay area, but individuals who live in the East Bay area are able to access services through other CCBHCs throughout the state. So there's the lay of the land as far as if you're familiar with catchment areas or areas of regions, CCBHCs, most of them are set up very similar to the CMHC system, and some of the CMHCs are CCBHCs. So the system,
Well,
the system has.
Can you just I'm sorry, can you just acronym what'd you say?
Yeah.
I understand CCBHC is Community Behavioral Health Centers, Certified Community Behavioral Health Centers. What was the acronym you were using?
Sorry, Community Mental Health Centers, CMHCs.
Thank you, thank you.
Yeah, so we kind of switched the letters around, but the providers are somewhat the same. But the criteria and what's required the standards have really elevated, and the payment for those services has also elevated. We've invested in our system, in a system that really needed investment. It was an underfunded system. So with CCBHC, we are getting we get federal funding, Medicaid funding. We're a demonstration state, which means we get an enhanced federal Medicaid match, which means less general revenue is paid out. And we at the state, again, have been able to raise our rates, raise that up so we can staff better. So a lot of positives have come out of the CCBHC implementation. And I just one more point before I go to Beth, is CCBHC is not just unique to Rhode Island. There's over 500 CCBHCs throughout the country. There's a network of CCBHC connections and providers. So we all are also under the same standards, almost under the same standards we had to get, the federal standards to get off the mark here. So just want to let you know the bar is high, and you have to have the services and you have to have the staffing to meet the high bar. Beth?
Okay, hold on one second. I'm just going to let my interpreter catch up. Okay, thank you. Welcome back.
Okay, thank you. So like Tom had mentioned, what is unique about the certified community behavioral health clinics are that they really are required to focus on.
Could you hold on 1 second, please? I'm so sorry, Beth. We're just switching interpreters, sign language interpreters. So let's just change the spotlight, and then I would really appreciate that. Thank you.
Sure. And I apologize for the possible slamming of the doors and children that you heard running out to Cub Scouts.
All good, Beth. Thank you so much.
Okay, thank you.
Sure. So like Tom had mentioned earlier, the Rhode Island Community Behavioral Health Clinics are really targeted to address services for what we call the populations of focus. And those are usually the populations that have been underserved previously. So one of the populations of focus for CCBHCs are individuals with co-occurring behavioral health, intellectual or developmental disabilities. And the CCBHCs are really required to kind of identify and address what the barriers are for access to these health services for those populations, and really try to create programs and services that are appropriate for these populations. So like we said, one of the populations is individuals with co-occurring behavioral health, intellectual or developmental disabilities. The other populations of focus include older adults, transitioned age youth, that's usually age 15 to 26, individuals identifying as LGBTQ+, justice-involved adults and youth, unhoused individuals, members of the armed forces or veterans, and individuals and families from under-resourced communities. So this is a long one, so I apologize, but just wanted to point out, like Tom had mentioned, the Rhode Island's certified community behavioral health clinics really have to meet a large amount of certification standards, which are federally mandated, and also, you know, Rhode Island specific, some of them. And some of those standards that really relate to IDD are listed here. Each CCBHC is required to provide services to individuals with co-occurring intellectual and or developmental disabilities. They are required to ensure that the treatment is appropriate and developmentally appropriate for the phase of life that they are in. And this also includes evidence-based practices that take into account developmental or other cognitive disabilities. CCBHCs may not necessarily be able to provide specialized services for things like IDD and TBI, but they need to have access to a provider or have consultation with providers who are specialized for treatment planning purposes.
And TBI is traumatic brain injury?
Yes, I apologize.
Okay, thank you.
Brain injury. CCBHCs are also required to have auxiliary aids and services that are ADA compliant and responsive to the people receiving services in their catchment area, and that includes physical, cognitive, and or developmental disabilities. CCBHCs are required to use standardized, validated, and developmentally appropriate screening tools. This includes things like the brief cognitive screenings or mini mental status exams, and the OBIS TBI screening form in year 2, which will start October 1st of this year. The CCBHCs will be doing a very brief version of this TBI screening tool. So it's kind of an exciting new feature that we're having to try to identify this population and their needs. And then again, in demonstration year 2, which starts on October 1st in this year, 2025, each CCBHC is required to have a care coordination agreement with a provider who specializes in support and services for adults and children with IDD. And what those care coordination agreements look like are really collaborative agreements that identify referrals and tracking information and key contacts at each agency so that they really can collaborate and identify any issues or barriers to care for the individuals being served by each agency.
That sounds great.
And these are just a link to some of the resources for CCBHCs. That is a link to our website. The BHDDH website has a little blurb on CCBHCs, where they are, and what they do. And then there is a CCBHC general one-pager that has a list of all of the CCBHCs and their access numbers, their appointment availability times, their website, and things like that. And then there is a referral guide that's also on there that's a little bit more specific to providers, but can be very useful in trying to figure out how to access any of the CCBHC services. And again, if you don't know which CCBHC you might be in or which catchment area, or you just, you know, don't have the time to go out on and look, you can always reach out to one of us, or if you are in a crisis or it's late at night and you need help, you can call 988 and they can refer you to your appropriate CCBHC in catchment area.
And I would just like to remind our audience that all of these resources will be available when we release the recording in a few days. So this is your contact information for anybody that needs it. I have Tom and Beth's emails here. I'd like to pause here for a second and ask if there are any questions in the chat for either Tracy or Tom or Beth.
So right now, Sharon, there's no questions in the chat. I am not able to see if anyone has their hands raised, so I don't know if we want to put the cameras on for a second.
Okay, let's see. There we go.
All right, let's see. I don't see any hands yet. I think
Any
we
questions?
are good. Nope, nothing.
All right. All right. Thank you so much, Beth and Tom and Tracy for joining us today. We're going to move on. I'm going to bring the screen back up. Okay. So our next guest speaker tonight is Christine Hathaway, who is a board-certified behavior analyst, Senior Director of Behavioral Health at the Perspectives Corporation, and also a certified behavioral plan writer. Welcome, Christine. We have Christine. Oh, you're on mute, Christine.
You said something earlier about this time of night and technology, and I think you were correct.
So, Christine, thanks for joining us this evening. And your questions are, what is a behavior plan? And what suggestions, recommendations, or practices do you have for consumers to achieve the best outcomes for their mental health?
So I'll start with well, I could do a lecture on both of these, but I'll try to keep it to just the time allotted. So in very simply speaking, a behavior plan is a formally written document. It's written by someone who has some expertise in mental health and understanding behavior, developmental disabilities for our population, and how people learn. And, you know, we all learn the same way, regardless of whether or not we have a disability, the principles are the same. But whoever writes the plan needs to have special qualifications to do that. So it's a written plan, and it addresses some behavior, some action on a person's part that is causing significant difficulties in their lives. So whether that aspect of life is employment, and I'm speaking specifically to adults. With children, you know, plans look a little different, but our lives as adults are more complex, and we're in work environments, we're in social environments, home environments, our relationships are pretty complex. So when someone has challenges in those areas, particularly in regards to their communication, or with their cognitive disability, that means oftentimes they're going to have trouble with executive functioning skills, their ability to problem solve, their ability to understand what's happening in the environment around them. That can be very complex for someone who's challenged with cognitive disabilities. So the likelihood they're going to have some behavioral expression of how to get their needs met, and also just expression of their emotions that might be inappropriate or sometimes unsafe, is pretty common for our population. So the plan really outlines what that behavior is and all the things that you're going to do on a regular basis to kind of minimize the occurrence of that behavior, what you can teach to either change the behavior or replace the behavior. So if someone is using their behavior to express displeasure, or that they don't want to engage in an activity, how can you teach them a more appropriate way to express no? So it can be focused on very specific things, very specific targets, but more generally in our population, people are much more complex. So behaviors are often reflect a number of different factors that cause them to occur, and even the reason for them happening. Oftentimes it's not as simple as just they're looking for your attention. You know, if it were that simple, they probably really don't need a behavior plan. There's often some complexity behind it. They're using it to express displeasure, they're using it to say they want something, you know, it's a multitude of meanings behind that and reasons why it occurs. So it can be quite complex. So with adults as well, aside from the environments we're in being more complex and less structured than most folks have experienced when they are children and in school, Our personality traits are more fixed. Our characteristics, our behavioral habits become more fixed and a little more difficult to change. And the other piece of that is our learning histories are just extensive. By the time you're a quarter century into your lifetime, you know, you've learned a lot and you've had a lot of experiences with different people, and sometimes those aren't the most pleasant experiences. So those learning histories really impact the expression of behaviors that can be very problematic. For this audience, you know, I'm assuming you're all providing self-directed services. So you are providing care in your home, and it creates a totally different environment when you're looking at challenging behaviors, and particularly those that have a mental health component. One of the goals really for a behavior plan is to keep that placement stabilized. You want to be able to continue providing that care in your home. So you're not going to be using strategies that are going to be pushing limits or are going to be so taxing on the family environment that your loved one can't remain home. Part of the goal of the behavior plan has to be to help maintain that placement.
So it's for I would say in the school world, you're like least restrictive environment. Is that what, like, would you like kind of be like the similar
Absolutely.
being able to keep it in the home? Okay.
Absolutely. And you know, I think that more and more clinicians are focusing primarily on positive support strategies and not restrictive at all. I know the company I work for, Perspectives, has moved away from using not only restrictive physical procedures, but other things that are consequences that are negative. So, you know, you and I have a bad day and we go home, and some of us might pour ourselves a glass of wine, right? And then have a little, maybe have some ice cream, right? Because we had a really crummy day. So why would you, just because somebody has a disability, take away something that is soothing or brings them some relief because maybe they didn't have a really good day. Maybe they weren't the most well behaved. It's one of those things, I think, you know, I've been doing this for a long time, and sometimes I feel like we want people who have disabilities to be more perfect than we are. And it's, you know, people
Sorry, I don't understand.
Did you hear my phone? It didn't understand. But I think hopefully my audience understands that in essence, we're all just people, and we have good behaviors and bad behaviors, and sometimes the things we do are problematic, and punishment really doesn't work very well for a number of reasons. So behavior plans are written to focus on all those multifaceted aspects of life that help you be the best you can possibly be. So they should be focusing on activities and interactions that help build self-esteem, help build on somebody's competencies so they feel like they're capable and contributing members of the family, the community, their environment, that help them feel both physically safe and psychologically safe, that they're accepted. There aren't people talking about them, you know, behind their back, or even with them in the same room saying negative things. You know, all those things are kind of spelled out oftentimes in the behavior plan if they have an impact on that person's behavior.
I'm just going to stop you there for a second. Let me just let the interpreter catch up. Okay, we're good. Okay, you can continue. Thank you.
Commonly, structure and routines are really important for folks in this population because it helps them understand their day, helps them understand their environment, and that looks different for everyone. And behavior plans for adults should be very unique and very personalized and geared towards that individual, and be very specific about what those schedules look like, what those routines look like, what you have to do in response to different things that come up. Many of our folks, it can be as simple as, you know, those people who don't respond well when you say no. But there are plenty of ways to set limits with someone for safety or otherwise, or because just circumstance don't allow that activity or that object to be had at that time without using the word no. So the plan kind of pinpoints what those things are that set the person up for failure. And so you can change how you interact with that individual. Many of our parents, I've done a lot of self-directed plans now, and the parents are just great. And they're doing really amazing things. And sometimes maybe too much, because one of those aspects of self-direction is you're the primary caregiver, you're there 24/7. It can be very stressful when you're trying to be almost so structured, it might be like regimented through your day, and having to negotiate those things that you can't control that might cause a transition or a change in schedule that could result in a behavior that the plan addresses. So it really spells out all those aspects of the environment, the interaction styles, how much noise, how much movement the person can handle, and is very specific about that. Aside from it kind of laying out in very clear terms the ideal, what we want to do to help teach this person how to negotiate their environment so they can be their best, so they can learn other ways of getting their needs met or getting the things they want without using these behaviors that they've learned in the past. It also provides you with a tool and a resource to train your staff so that they can refer back to when unusual things come up that, you know, maybe not happen every day, but from experience, you know, it's a trigger and it could cause a very difficult scene. So having that information at hand so you can train your staff and you can get a level of consistency when they're working with your loved one is, I think, a really important thing. For self-directed services, it feels sometimes like people just know they need it because they have a tier E and it's a requirement. But it's much more than just a requirement. It really is a very helpful tool. And it's something that I think in terms of that behavioral plan writer, they do just write a plan, right? They write a plan, it gets submitted. For individuals who have mental health problems, you have the ability to access that clinician to help you through and negotiate. Part of your plan, particularly if your loved one has behavioral issues that present significant safety concerns and may involve the use of emergency services, that plan can include a crisis plan so that you are prepared if something should happen. And it's not a situation that presents you with fear or anxiety, that you can feel comfortable going into it, that you will be able to handle it and keep your loved one and your other family members safe. And that's really important for you to have. And if that involves using emergency services, also having a plan of care that you can give to the hospital, whoever the clinician is who is going to be evaluating your loved one, they often have no information to go on. And in my experience, our folks often arrive at the ER, and that's where they feel safe and comfortable. They're removed from the environment where the stressors existed, and people come in and evaluate them, and they don't really understand why they're there or what the situation is. So the clinician can really provide whoever is assisting the person with self-directed services, the tools to help negotiate those situations. So when you need them, you can access them without it being such a uncomfortable situation that you don't want to make the call, you know, so you maybe lock yourself in a room for safety because, you know, maybe the person, maybe your loved one is taking out their anger on you. It happens frequently and people are reluctant to call for help. A behavior plan can help you by setting out all those contingencies so you can see it coming and you know what you need to do as it's an evolving situation. And should it come to the point where you need help, that you're prepared. And also your local EMTs and police department and emergency room is also understanding and prepared. So one of the things, the other question there is my recommendations. And my recommendation would be, if you are struggling with situations that are kind of scary and present risks to the individual, risks to members of your family, use that clinician to help you prepare and lay out a plan that makes sense for you and your loved one and your family so that you can maintain safety and you can help them through that situation without inadvertently doing things that might make it worse. You want to have a good understanding of what their mental health issue is and how it expresses itself in everyday living, so you can set your loved one up for success by really focusing on the positive aspects and what they need to strengthen their ability to be more resilient to whatever their struggles, internal struggles are. So I think I've gone through my time, but I want questions if anybody has any.
Sure. That was great information. Thank you so much. And I'm thinking, Christine, that one of the ways that families could prepare would be to fill out the form for the special needs registry through the Department of Health, as you know, because then they'd be on a radar that something might you know, for emergency situations.
From my experience, that information doesn't always get to the people who need to know when they need to know it. So depending on the, you know, everyone's circumstance is so different. So it's hard to speak in generalizations. And I'm really referencing kind of the most severe cases. But if you are anticipating that there could be a situation where you might need police assistance, then I would go and talk to my local police department and prepare them and maybe introduce them to the person who might need their services, because sometimes our folks are afraid when the police show up as well, to develop that connection. So hopefully it ends there and they can help de-escalate the situation in the moment. If somebody's focusing all their anger on you, it's very difficult for you to be the one to de-escalate. Sometimes it helps for a little separation. And if you don't have others in your environment to help you, sometimes the local police department can be that person.
Liaison. Okay.
Yeah. Similarly with the emergency rooms, if you have a written plan of care for what you're just kind of describing your loved one's situation and what they might need in the moment when they present at the ER, that helps everyone in the emergency room kind of figure it out and know who to call and help resolve that situation. In every case, the goal should be to get your loved one home as soon as possible, right? You don't want them lingering in the emergency room. You don't want them inpatient if that's not where they need to be. So, you know,
I think as family and staff and caregivers, you know, pre-planning is always something that we would welcome, so that in the moment we know what the next steps are.
Yeah.
All right. I'm going to share your contact information Christine, she, like I said, she works at Perspectives Corporation, and this is the main number for Perspectives, and their office hours are 8 to 4:30. I'm sure you could leave her a message if you prefer the phone versus the email. And I'm going to I'm going to stop sharing and check with my staff and see if we have any questions for Christine.
There's no questions in the
Mhm.
chat right now, but
Nope.
Linda and Sean said that the local police department have forms that you can fill out to make them aware of
Mhm.
special needs person at your address. I love that. I just love that advice about, getting ahead of it, introducing them to the local
Yeah.
police. I think that's great. And then Sharon, as far as hands go,
Can I
don't-
just add to that too? The local
Sure.
community police officers, most departments have one, and they can be really wonderful because oftentimes too, our individuals, based on their learning history, have been exposed to different kinds of programs that consequent them for some unsafe behaviors in different ways, right? They might be aggressive. And oftentimes folks learn they can be aggressive towards their staff because there's a behavior plan in place in school that helps them deal with that. But now they're not in school anymore, and now they're living in a community, and it's much different. And there is a period of time where people need to learn what it means to be a good citizen. And the local community police officers can be really helpful having conversations that make a little more sense because they're in context, for the person to understand.
And
That's
there's
great.
no hands raised. And as
Okay.
a teacher, we had plans. I had behavior plans. Actually, my social worker and psychologists are in the audience, and they were lifesavers when something was happening. So I can just attest to how important it is to have that plan in place. Okay,
Wonderful.
we're good, Sharon.
Okay. All right. Christine, thank you very
No,
much.
thank you.
And we're going to move on to our last speakers. So I'd like to welcome to the table Dr. Cooper Woodard. Dr. Cooper Woodard is a board certified behavioral analyst and chief clinical officer at the Groden Network. And his partner is Dr. Shireen Holly, who is a psychologist, also a BCBA for outpatient services at the Groden Network. So welcome, Dr. Holly and Dr. Woodard.
Thank you very much.
And your questions are, so are you each taking one question or should I say them together?
I think we decided I would start off with the first question.
Okay, so what services and supports exist at the Groden Network that support adults with intellectual and/or developmental disabilities and their mental health?
Okay, so again, my name is Dr. Cooper Woodard. I've been at the Groden Center for 23 years, and Dr. Holly and I are here because we both work in outpatient services. So outpatient services is part of a larger array of services at the Groden Network. So we serve the entire lifespan. We start with early intervention services. We have treatment foster care services. And another service that I thought might be of interest to this group, I'm not sure if you're familiar with, we have a program called PFEP and FPP. And those are support services for adult parents with developmental disabilities. So if anyone would like more information on that, I can get that for you and put you in contact with people who know about that service.
Yeah, that'd be great.
We have community and home-based services, and we have the Groden Day Program, Groden Residential Program for adolescents. And then in Rhode Island, we have the COVE program, which serves adults with developmental disabilities and intellectual disabilities in day and residential. And then we have the same service at the Halcyon program in Massachusetts. So it's a large array of programs that we have, but Dr. Holly and I are here because what we do is we work together in outpatient services. The Groden Network tends to focus on persons with severe intellectual disabilities and also behavioral challenges. That's kind of our niche. The outpatient services program is a little bit different, though. The outpatient services program, a lot of the people that we work with in individual and group therapy really don't have intellectual disabilities or have moderate or mild intellectual disabilities, and might have likely to have an autism diagnosis. So it's kind of a wide spectrum that we work with. Again, we have individual and group therapy services. Dr. Holly tends to work more individually with children. I tend to work more individually with adults. And we have a couple of groups that we do each week. And the groups focus mainly on resolving issues that group members may encounter that are related to their autism diagnosis, family issues, work issues. And it's a nice place to be together with other people who are facing similar challenges. And so there's a lot of support and encouragement, but mainly we work on challenges that people encounter that are unique to each person and help each other with those and kind of practice social skills and things like that. So.
Well,
So
everybody needs a buddy.
everybody needs a
Right?
buddy, and I have I have
Exactly.
Dr. Holly, so that's nice.
All right. Dr. Holly, would you like to add to that?
Yeah, well, I think that was very thorough, which is why I asked Dr. Woodard to start us off, because he's been
Okay.
with the network for so long. He really knows it very well. And you know, at outpatient, what we do, as he was mentioning, is a little unique. Because what we're trying to do as psychologists is provide therapeutic services, but each individual we work with is a little different, and what they need is a little different. And so when we talk about like barriers to providing services, I think the first thing that comes to mind is just the sheer lack of professionals who are available to support this population. You know, a lot of individuals, a lot of clinicians who provide therapy kind of shy away from the population of individuals with either autism or other developmental disabilities. The techniques they learn and, you know, the strategies they're used to utilizing in sessions don't always work as well with individuals who might think a little bit differently or see the world a little bit differently. So we definitely hear from a lot of families that, you know, finding a good therapist is really hard. And so we try our best to try and, you know, serve as many people as we can, but there just really we need more clinicians in the field in Rhode Island in particular. I also think it's challenging that, you know, to adapt certain modalities of treatment to that individual, you know, being able to understand, let's say, that, you know, that the individual's insight might not be necessarily as developed, or their perspective taking skills might not be as strong. Sort of forces you to change your strategy. And every client that I've worked with, a lot of them are children, but I've got a few adult clients as well. And you really have to meet them where they are. And so you have to be flexible. And I think that can be challenging sometimes too. You know, I think it's fun. I think Dr. Woodard and I have fun kind of being creative. And how can we meet this person where they are? How can we figure out, you know, how to get through to them in a way that makes sense and is kind and is, you know, respectful. And so we do collaborate a lot, because I think, you know, it's important. You know, and I think generally speaking, you know, when I saw the question, what is like one of the big barriers?
Yes. As practitioners, what have you seen as the biggest barriers for your clients striving for mental health wellness?
Yes, thank you. I should have read that question too.
That's okay.
When someone presents with a developmental disability or an intellectual disability, or they're diagnosed with autism, that usually overshadows some of the other mental health issues they may also be struggling with. And so a lot of clinicians, like a lot of general practitioners, you know, pediatricians and other medical providers may say, oh, well, that's just autism. right? It's just the autism. But the truth is, a lot of times there's more going on and it's more complex than that. And so what we try to avoid a lot is this phenomenon called diagnostic overshadowing, right? So autism overshadowing any other potential condition like anxiety or depression or OCD, obsessive compulsive disorder. So our population has a lot of different needs, and being able to see, okay, well, this person may very well have autism or developmental disability, but they also are really struggling with anxiety. And I have to figure out how to move past sort of behavioral treatment and support them with their mental health and their own sort of, goals. That's hard. It's hard to do. And I think, it's always a work in progress, which is why consultation is so important. But, to me, I think that a lot of the individuals that land at outpatient services have been, bounced around a little bit. And some of the clinicians that they've visited with before might say, I'm not really sure how to help you. And, it's hard to see that. It's hard to hear that. So we really strive. One of the things we always sort of have as sort of our main goal is how do we respect that individual's personal agency, and sort of how do we make sure that their goals are the priority, that we're not trying to fit them into what society wants, right? We're allowing them to sort of have their own self-expression and celebrate their uniqueness, but also make them effective in society as well, because we all need to live in this
There's
world together.
rules, right? We still have to follow the rules.
There
Yeah.
are rules, yeah. So we want to be tolerant. We want to embrace kind of all the uniqueness that is each of us, but we also want to make them safe, successful, independent as much as possible. So, that's always kind of our goal is what's right for that person. And everyone's a little different. So
The only thing I
you think of another one? Go ahead.
Go ahead.
The only thing I was going to add to that was, as Dr. Holly mentioned, there's a lot of depression, there's a lot of anxiety, and a lot of times this leads to isolation. And life is complicated. You have challenges with Medicaid and insurance and housing and money and all of these things. And I think the isolation makes it even more difficult sometimes to navigate those different services and really know what to do and how to keep after them. Because, even with the acronyms that we have here tonight, that alone can be really confusing for people. And
Right.
a lot of times, if you're by yourself, you just want to give up. And so I think the isolation is a big barrier, and the complexity of the things they have to work with.
Excellent. Excellent advice.
Sharon,
Right.
I
Yes.
do have a question and a comment
Okay.
for both of them.
Okay. Hold on one second. Let me just move on to the next slide, which is their contact information. So we have Dr. Holly and Dr. Woodard's emails, as well as the number for the Groden Network. You can call them directly. Okay, go ahead, Jean. What do we got?
Sure. Sorry about that. I should have waited
That's
a second.
okay.
I got ahead of myself. I got excited. No. So Susanna was asking, it is very difficult to find providers who specialize with adults with intellectual disability. Do you have outpatient services for adults age 20 with intellectual disabilities, but not diagnosed with autism?
Yes, absolutely. We've had a number of clients who don't have autism, but who have intellectual disabilities.
Thank you so much.
We also have a few clients with different presentations. So, physical disability, because a lot of times adults, as you all mentioned, after the school system, after they get through the school system, they're sort of lost. So it may even be like a physical disability, but they're common challenges, regarding that isolation piece and navigating this kind of transition into becoming more independent. It's very common across many of our clients, which is one of the things I think our group is really good at, is sort of sharing support and also, guidance. to how to navigate, Medicaid issues and how to get a ride, get on the ride bus, right? And how to apply for jobs and interview skills. And so there's a lot of things that we do, but yes, absolutely. We do have a number of clients who are diagnosed with intellectual disabilities or, severe OCD, various things. It doesn't
Okay,
have to be doctors.
Do doctors prescribe medication or just do therapy? That was another question from
So
Lori.
Dr. Holly and I are psychologists, so we cannot prescribe. That's beyond our competence. So but I can tell you what we do is I have attended psychiatry appointments, and with the client's permission, usually with the client present, have given them, kind of update and progress and my impression as to what direction the psychiatrist may want to look in terms of the emotional presentation.
Okay, that's great.
That's helpful.
That is very,
Go ahead.
and obviously there's another question from Linda and Sean. What about ADHD and anxiety combo? Would you also work with folks?
Yeah.
I'm assuming.
I mean, I can think of a number of clients who have those diagnoses that we work with. Certainly anxiety. Anxiety is very, very common in the population that Dr. Holly and I work with. And I would guess maybe, Shireen, that you see more of the ADHD than I do with the children. I'm not sure.
Yeah, I think the adults that we work with, and thinking specifically about the group that we have for our adults, we always sort of try to determine if it's the right composition. And so the topics that we address, or the types of conversation we have, sometimes we want to make sure that the individual joining the group is at the same level of functioning, more or less, so that they are supportive, and we're not talking about things that they've already mastered or that are well beyond their current goals. So it does depend. Every referral we get, every intake we do is personalized. We want to make sure that individual lands in the service that's going to best serve them. Sometimes that means, our current group isn't the right fit, but, hopefully in the future we have more opportunity. And, kind of circling back to my first point, we don't have a lot of availability to take on new clients, unfortunately, because we're in the same position where we're taking as many people as we can, but we just really are kind of, maxed out to a degree. So that's another frustrating piece, is we just can't do everything.
Can't do everything.
Let me just
All right.
add too, that if you do call that number, the extension that to get through to Dr. Holly is 1242. I should have given you that.
Okay. That's okay. All right. We're going to stop there with questions because we're coming up on the hour, but certainly we will make sure that we will gather any questions that we have not answered at this point and make sure that they're shared with both of our doctors. So thank you all for coming tonight. We just wanted to let our audience know that our next in-person event is going to be in June for the RIPIN team. We are hitting on the road for a self-direction scoop, snack, and chat. It's going to be Thursday, June 26th from 4 to 6:30 at Impossible Dream. And you can register by going to our website or by using the QR code on the screen. Last month, this team debuted a self-direction support toolkit, which has lots of sample schedules. It gives you some ideas about how to hire staff or some questions to ask for staff. And it also includes a community guide where you can find a lot of fun things to do, especially with the nicer weather that's rolling around the corner. So we encourage you to check that out. We have a Navigator newsletter if you have not already signed up for that. We release an English and a Spanish version every month. We're just coming up on our 1-year anniversary on this, and it's filled with lots of information from our state partners as well as fun tips and tricks that we find for self-direction. So this is the survey for tonight. I thank you again. The team thanks you for, and we want to hear your thoughts about tonight's presentation. We know that your feedback is important to us, and we always try to improve our services and make sure that the topics that we're bringing to our community are serving what our audience is looking for. If you've missed any of our webinars and want to go back and see some other content pre-recorded, you may do so on our webpage. And this is our contact information. We always encourage families and consumers to reach out to us for support. It's self-directed support at ripin.org.